With us here on Facebook this morning during this morning's live update, we will have Dr. Bob Lutz with the Spokane Regional Health District. He will be giving his daily update. He'll also be joined by Spokane Valley Mayor Ben Wick and also Jamie McIntyre with the Joint Information Center here, who will also be speaking about community response to the COVID-19 pandemic going on right now. The topics this morning will include donations, social distancing efforts, and also purchasing practices here locally. Now, if you have any questions, please share them with us on Facebook here this morning. We'll try to get to as many of those as possible. Please address them to each of our speakers. And with that, we will start with Dr. Lutz.
Well, good morning. I do believe that the governor's message about staying home and staying healthy is starting to have an impact. We're certainly at the state level seeing a leveling to some degree of the number of cases. That said, we are still seeing an unfortunate rise across eastern Washington and here in Spokane. To date, we have 222 confirmed cases, and unfortunately another individual has died of COVID-19. He was a gentleman in his 90s. To date, we have had 35 individuals who have required hospitalization. Recently, you are well aware of the fact that the CDC has provided some new guidelines on homemade masks, and the reason they've made these recommendations is because they have identified that some individuals who are minimally or actually without symptoms may actually be transmitting the infection. And so these masks are really not so much effective to prevent somebody from getting infected, but more so it may, for somebody who is asymptomatic, it may actually prevent them from spreading the infection. And so I think it's an important consideration when you're out in community settings where, again, although you are still practicing social distancing, you do find yourselves interacting with other people. So it not only can prevent you, who may have infection and not be aware of it, from transmitting it, but I think it also sends a message. I think it also sends a message that you really care about the members in your community that you could be impacting. And so again, I encourage you to consider the CDC guidance on wearing homemade masks when you're out and about. Many people are asking about the different types of testing. You've heard about, for example, antibody testing. And antibody testing is certainly something which I believe to be part of the entire approach to addressing the COVID-19 pandemic. It, however, has its limitations, and the limitations are as follows. Essentially, when someone is infected, the immune response causes the body to make antibodies. That is not an immediate effect, however, and as a result, people will make antibodies, but they may not make those antibodies for maybe 10, 15 days after the actual onset of symptoms. And so therefore, antibody testing is going to be effective to some degree of identifying individuals who have been infected, but for us right now, much of the priority is around identifying individuals who have the infection now, rather than having had the infection in the past. So I think that antibody testing in the future will be a good component of the overall response to COVID-19, but right now our priority is really on identifying individuals who currently have the infection. You've also heard about this rapid test, not unlike when you go into the clinic and you get tested for strep throat or maybe flu. We do know that a number of these machines do exist in eastern Washington and even here in Spokane. One of the rate limiting factors, however, is that, like across the rest of the country, we may have the machinery, we just do not have the materials to actually run the tests. And so stay tuned. We certainly hope that the companies are able to make more of the materials for these tests, but right now they're really not an effective means to identify the infection in our community. We do, however, continue to emphasize and encourage people to visit the drive-through clinic at the fairgrounds. As we mentioned last week, it's in a new location, but still at the fairgrounds. It is undercover for our, unfortunately, spring-like weather of inclement weather. And again, remember that although you may be there, that does not guarantee that you will be tested. Rather, you will continue to be assessed, and then based upon criteria, you may or may not get tested. So again, if you think you have symptoms, if you feel like you have symptoms and you're concerned about being tested, call up the nurse's helpline. But again, the fairgrounds is available for you to be tested. And I think at that point, I'm going to turn it over to Jamie.
Good morning. I'm Jamie McIntyre, and I'm sharing information today on behalf of the Joint Information Center, which we also call the JIC. Spokane is a strong and resilient community. In the midst of the new abnormal, our community has stepped up to help out in many ways by donating our time, skills, and resources. In response to the community outpouring of support, the Inland COVID-19 Response Team opened a community donation site at the Spokane County Fair and Expo Center. This site serves as the central donation point for community members to drop off donations to help frontline workers, first responders, healthcare partners, and people at greatest risk of complications from COVID-19. This donation site is open daily from 9 a.m. to 3 p.m. and accepts donations of new items including personal protective equipment such as gloves, masks, hand sanitizer, gowns, and eye protection, as well as new sewn fabric masks, paper towels, toilet paper, and household disinfectants. The daily operations of this donation site are made possible by the support of Spokane County United Way staff and community volunteers. As of Friday afternoon, this site had received donation of over 500 fabric masks, as well as N95 and surgical masks, goggles, and gloves. Every donation is greatly appreciated, and the items of greatest need continue to be personal protective equipment and sewn fabric masks. If you have any of these items you are willing to share, please bring them by the Spokane County Fairgrounds using the entrance off of Broadway. We will ensure they get to the people who need them. The donated items we receive from the community are being decontaminated and sorted before distribution. We anticipate starting distribution later this week to established organizations and health partners that may not receive supplies as quickly through the state allocation process. And the need remains. We've received numerous requests from organizations and are processing through them as quickly as possible. If you represent an organization in need of donated items, additional information will be posted later this week via the Inland COVID Response Facebook page. Through this page, we will also provide updates on donated items and distribution. I want to end by saying thank you, Spokane. Thank you for uniting together to support each other. We are stronger together.
Hello everybody, my name is Ben Wick. I'm the mayor of the city of Spokane Valley. We know during this uncertain and challenging time that we're all feeling stressed and even fearful. But as our community unites to face these challenges, I see strength and resilience. While temporary and different, we're all trying and learning something new, from how to interact with our loved ones via an electronic environment, or asking for help for our businesses and our families to be able to provide for their needs. The work we're all doing together as a community is impressive, and I want to thank you on behalf of everyone at the Unified Inland COVID-19 Response Team. We also want to acknowledge and thank all of our healthcare workers, our medical staff, first responders, and our incredible businesses who have found inventive ways to help as we face the COVID pandemic as a strong, united community. Your hard work, long hours, and dedication is admirable. We are incredibly grateful for each and every one of you. Please stay home, stay healthy, maintain your social distancing of 6 feet. As Dr. Lutz mentioned, and with the CDC guidelines, please use a mask while going out into the community. Wash your hands and continue working together. Remember, we are inland strong, and we will get through this because of your efforts. Thank you.
Dr. Lutz, we have one question, if we could have you address it. You touched upon the need for plasma, especially for individuals that may have recovered from COVID-19. Could you expand on that a little bit? What is the need in the community for plasma in general, or what is the science out there about plasma from those individuals? Again, if you could reiterate some of your comments on that.
Yeah, I think I will not address specifically the need for plasma in our community. I'm not really aware of that and able to speak to that, but I think there is questions as to whether or not individuals who have recovered from COVID-19 could donate their plasma. Interestingly, plasma has been used for over a century to create essentially materials that can provide an immune response. So essentially, when somebody has an infection, their body creates immune antibodies, and those antibodies can be taken from plasma. They were studied during the SARS, during MERS, and during, for example, H1N1 during 2009. Right now, the use of antibodies from plasma still remains very investigational. The FDA is considering it. There are a number of trials that are ongoing across the country looking at it. But for right now, as I mentioned, it truly is just investigational. So stay tuned. We may learn more over the coming weeks and months, but right now, we are not really encouraging people to donate plasma to obtain antibodies for COVID-19.
We also have another question from one of our viewers watching right now. We'd like to know, you said multiple times that the curve does not seem to be flattening, though numbers available to the public appear to suggest otherwise. He wants to know if there's any other additional information that's available or where you're getting your information that you're sharing.
Sure. So I think there's a little bit of discrepancy between some of the media that have reported that at the state level we see a quote-unquote flattening of the curve versus what we are seeing in Eastern Washington and locally. So our numbers continue to rise. They're not necessarily rising exponentially, which is oftentimes what you see at the beginning of a pandemic curve, but we continue to see a rise. So I look at the numbers that over the past weekend, we've had maybe 20 to 30 more individuals that have been diagnosed. And again, much of those numbers are based upon testing strategies. I see the county, Yakima County, has been significantly impacted with more than 300 cases. So I think that we are not seeing an overall flattening of the curve at the local level, although when I look at it from a state level, we certainly see that the number of cases appear to be decreasing on the west side in the Puget Sound region.
We also have another question, and it seems like you're hearing it over and over again. You touched on this earlier today. It's the topic of masks and how important they are at this point.
Certainly, we have heard changing guidance, if you will, over the months about the benefits of masks. The new CDC guidance around wearing homemade masks in the community really speaks to the point that we know that a number of individuals may be asymptomatic and yet could be shedding the virus. And so wearing a homemade mask, we're still obviously emphasizing that surgical masks be left for first responders, for healthcare personnel, those vital employees and staff who are taking care of individuals who are ill. But homemade masks, again, may be of benefit, especially if you are asymptomatic. It reflects the fact that you care about the other community members that you may be coming in contact with. And again, it's always done in the context of social distancing. So we're still encouraging people to maintain their appropriate social distancing when out and doing essential activities, and consider and actually recommending that homemade masks are something that should be done.
And then our final question this morning from another viewer wanting to know, there are folks that have become more forthcoming about contracting COVID, like where they work, where they've been, things like that. Contact tracing is good for those close to the person, but what about the strangers that have also had contact with this person?
Yeah, so with respect to what we know about contracting COVID-19, it usually requires you to be in close contact being defined as less than 6 feet for a prolonged period of time, defined as more than 10 minutes. And so those casual contacts with someone probably is not going to be a significant risk factor for the infection. That said, if you know that you have come in contact with someone, irrespective of the length of contact, then we do recommend that you continue to monitor your symptoms. And certainly, if you do find yourself having any of the classic symptoms, those being a fever, cough, shortness of breath, chest tightness, maybe even a sore throat, those would be reasons why you would want to seek medical care and or evaluation. You may consider, again, even sort of providing a little bit of self-quarantining just to make sure that if your concerns are for you or loved ones, that you are, again, looking to provide that little bit of protection. Yeah.
That's an awesome question.
Okay. Well, then, we thank you for tuning in today, and we will see you tomorrow morning.